The functional anatomy of the hip joint in a single leg stance. The acetabellum. Location. The acetabellum is a cavity found on the lateral part of the pelvis where the ilium, ischium, and pubis join. It is inferior to the ilium, posterior to the pubis, and anterior to the ischium. Shape and attachment. The acetabellum is a ball and socket joint. Therefore, it is cup-shaped to allow for the head of the femur to articulate with it. It is a deep concave joint, which allows for increased surface area with the femoral head. The acetabellum allows the femur to insert into the pelvic bone to create the hip joint. This joint is lined with a fibrocartilage rim, which is called the acetabular labrum, which further deepens the joint. Function. The primary role of the acetabellum is to be a stable joint for the femoral head to allow for movement while preventing dislocation of the femur from the acetabellum. These movements are such as balancing on one leg, running, and walking. The acetabellum creates the hip joint. Due to the depth of this joint, it helps provide stability. The acetabellum is important in the weight bearing of the upper body onto the lower body and limbs. The acetabellum distributes force evenly on the hip joint to reduce risk of injury and stress. The biomechanical application. When standing on a single leg, the hip joint on the supporting leg bears the weight of the body on itself. Due to the depth and the shape of the joint, it will allow for the femoral head to be secured stably and will assist with lateral tilt and translation movements. Its cup-like shape will help to physically restrict the amount of movement of the femoral head while providing stability. The way in which the femoral head and the acetabellum fit together provides inherent stability before required muscle and ligament contractions. The acetabellum helps with keeping the pelvic alignment. Due to the structural stability of the hip joint, it allows for weight transfer from the body's trunk in the supporting leg, which helps with energy usage and maintaining stability while balancing on one leg.
Skeletal landmark, greater trochanter structure. Here we can see the greater trochanter, which is a large bony projection found in the proximal femur. It's located where the neck of the femur meets the shaft, about 2 to 4 centimeters lower than the femoral head. The greater trochanter serves as an important landmark that differs slightly between males and females. For example, the distance between the two greater trochanters is wider in females due to a larger pelvic outlet. Its rough and irregular surface provides multiple attachment sites for muscles and tendons involved in hip movement and stabilization. Muscles such as the gluteus medius and gluteus minimus, including others, attach here. These muscles work together to allow movements like hip abduction and external rotation. Without the greater trochanter, the hip would lose significant leverage and stability, reducing both power and control during movement. Biomechanically, the greater trochanter plays a key role in single leg stance stability. When standing on one leg, muscles like gluteus medius and minimus contract to lift the opposite side of the pelvis, preventing it from dropping. The greater trochanter provides a mechanical advantage needed for these muscles to generate upward force against gravity. This mechanism is essential for efficient walking and running, helping maintain balance and reducing strain on the lower back and knees.
The iliofemoral ligament is a Y-shaped ligament originating from the anterior-inferior iliac spine and the rim of the acetabulum, and it attaches to the intertrochanteric line of the femur. It's Y-shaped is due to being made up of two bands, the medial band, which is vertical and runs parallel to the femoral shaft and attaches to the lower part of the intertrochanteric line, and the lateral band that is oblique and runs parallel to the axis of the femoral neck and attaches to the upper part of the intertrochanteric line. As the strongest of the ligaments in the pelvic girdle, the iliofemoral ligament assists in the stability of the hip joint. It limits extension, external rotation in full flexion, external and internal rotation in full extension of the hip. It also helps maintain static erect posture and supports traction of the hip up to 350 kilograms. When standing on one leg, the iliofemoral ligament tightens, preventing the hip from hyperextending and preventing posterior pelvic tilt. The ligament helps keep the pelvis upright by limiting excessive adduction and extensive rotation of the femur by keeping the femur head within the acetabulum. It also helps stabilize the muscles like the gluteus maximus and minimus keep the pelvis level. The surrounding muscles do not experience constant fatigue due to the assistance of the ligament, which prevents their constant use.